Welcome to the Deep Dive. Today, we're really getting into something fascinating in healthcare, integrative medicine.
That's right.
We've got a whole lot of material here from the Neitropia Clinic, which gives us a great look at how they do things. So the mission today, for you listening, is to walk away really getting what integrative medicine is all about, how it works in practice, and why it's getting so much attention.
Exactly. And we've gone through these Neitropia sources pretty carefully. The idea isn't just to list definitions.
Right.
We want to pull out the core thinking, the philosophy, and show you the practical side too. What makes it actually integrative?
Oh.
How does it go beyond just, symptom chasing?
All right, let's unpack that. Neitropia starts with a pretty clear definition. They call it a healing-oriented approach.
That phrase itself is interesting, isn't it? Healing-oriented.
Yeah, it sets a different tone right away.
Yeah.
And they stress that it takes account of the whole person.
Which they define quite broadly.
They do. They mean all aspects of physical, mental, emotional, and spiritual health. So it's comprehensive.
And what's really fascinating is how that pulls together things that often get separated in conventional medicine.
Like mind and body.
Exactly. We kind of know intuitively that our physical health is tied to our stress levels, our emotions, even for some, a sense of spiritual well-being. This approach just explicitly acknowledges that connection, and crucially, it talks about a partnership between patient and practitioner.
So it's not just the doctor telling you what to do.
Right. It's meant to be collaborative. It empowers you, the patient, to be involved. And the big one, addressing the root causes of illness rather than just treating symptoms.
Yeah, it feels like the core difference.
It really is. It's a shift from just putting a Band-Aid on things to figuring out why the problem is happening in the first place, trying to get to that deeper imbalance for hopefully more sustainable health.
Okay, so that's the big idea, the philosophy. But how does a clinic like Neitropia actually do that? What does it look like day to day for someone walking in?
Good question.
They talk about internal integrative medicine with comprehensive care. First off, they mention personalized treatment plans.
Which makes sense, right? If you're treating the whole person, everyone's whole is different.
Exactly.
Yeah.
Tailored to your specific needs and goals. No cookie-cutter approach here. And they do this using a wide range of therapies.
And if we link that back, that diverse toolkit is kind of essential for tackling the whole person idea we just talked about.
Right.
Different health issues, whether it's, digestion or pain or anxiety, they often need different kinds of help.
You need more tools in the box.
Precisely. So they list things like standard internal medicine, but also homeopathy, body-based therapy, massage, manipulation, that sort of thing, herbal medicine, and nutritional counseling.
It's quite a spectrum.
It allows for that custom fit, finding the right combination for your specific situation, not just relying on one single method for everything.
And beyond those, Neitropia also lists some more specialized things, maybe things people haven't heard as much about.
Okay, like what?
Well, there's traction and motion. Sounds like a specific kind of physical therapy, maybe using movement with traction.
Interesting. Spinal decompression, perhaps.
Could be. Then there's disc hernia relief through Arcure technology. That sounds very specific, like a targeted tech for disc problems.
A non-surgical option, it seems.
Yeah. And then neurotherapy, which often involves, brainwave feedback or similar techniques to optimize brain function.
Neurofeedback is one type.
They also mention Onuri Medicine Sujok. I believe that's a Korean system focused on points on the hands and feet.
Right, like a form of microsystem acupuncture.
And TES therapy. I think that stands for transcranial electrical stimulation, using mild electrical currents.
Yes, often used to modulate brain activity for various conditions.
And finally, a Camera Delta laser. That's likely a form of low-level laser therapy, sometimes called cold laser, used for pain, inflammation, tissue repair.
So, yeah, that raises a really important point, doesn't it? How do all these different things from herbs and nutrition to, lasers and neurotech actually fit together?
How they integrate.
Exactly. It shows they're committed to, finding the right tool or combination of tools for your specific needs. It's really moving away from that one-size-fits-all idea that sometimes happens in healthcare.
It's about building a strategy from different angles.
A multifaceted strategy tailored just for you. That seems to be the goal.
So thinking about someone considering this kind of approach, why choose a clinic like Neitropia? What do they highlight as their sort of core values or reasons?
They're pretty clear on that. First, they talk about having an experienced practitioner. They mention highly qualified quality care, and being dedicated to achieving stable homeostasis.
Homeostasis.
Yeah.
That's like the body's natural balance, right? Keeping everything stable inside.
Yeah. Precisely. It's your body's optimal operating state. Getting you back to that balance is the aim. Second, they stress the holistic approach again.
Back to the whole person.
Yep, the whole person, not just the disease. That's central. And third, patient-centered care.
The partnership idea.
Right, that partnership between patient and practitioner working together for optimal health. These aren't just, marketing terms for them. They seem to be the actual pillars of how they operate.
And you can see how those points line up perfectly with the definition of integrative medicine we started with.
It creates a consistent picture.
It does. It's not just theory. It's how they structure the care itself. But, with all these different therapies, especially some of the complementary ones, how do they ensure they're using the best, most up-to-date methods?
That's a really good question. And actually, the materials give us a little window into that. It shows there's still innovation happening, even within therapies that have been around a while.
Ah, right. They highlight a specific example within homeopathy, Dr. Marcello Candegapi. He sounds like a significant figure. He was a professor, taught homeopathic drug administration and the history of homeopathy. He was also the director of a major Argentinian homeopathic medical school, EMHA.
So a respected figure in the field.
Definitely. And his contribution seems to be around methodology.
Huh?
He developed something called HUMA and the Candegape algorithm.
HUMA algorithm in homeopathy.
Yeah, sounds intriguing. The HUMA system seems to be a way of understanding the patient's constitution, their deeper patterns. And the algorithm is described as an ingenious method, a systematic approach to diagnosis to help pinpoint the right remedy.
So, ways to make homeopathic prescribing more precise and personalized.
That's what it sounds like. The source says these provide powerful new tools and perspectives.
That's quite significant because sometimes people think of fields like homeopathy as being, static, unchanging.
Right. Set in stone.
But this example shows there's actually this drive for methodological improvement, for innovation, for making the practice more rigorous and tailored.
It suggests they're not just mixing therapies, but also refining the individual components.
Exactly. It shows a commitment to advancing the techniques themselves, continually looking for better ways to help patients achieve those health outcomes. That adds another layer to the integrative approach.
Okay, so let's wrap this up with a quick recap. We dove into integrative medicine today. Defined it as this healing-focused approach, looking at the whole physical, mental, emotional, spiritual. Big focus on root causes, not just symptoms, and that proven patient-practitioner partnership.
Right. Collaborative.
Then we saw how Neitropia puts that philosophy into action. Personalized plans using a really wide mix of therapies, everything from internal medicine and nutrition to specialized tech like art cure or neurotherapy.
All brought together in a customized way.
And we even saw that drive for innovation within specific therapies, like Dr. Candegape's work refining homeopathic methods.
So connecting this to the bigger picture for you, the listener, getting familiar with these ideas behind integrative medicine, it can really empower you. Well, it encourages you to view your own health through a wider lens, to think about all the aspects of your well-being, not just, say, the headache or the stomach issue in isolation.
Seeing the connections.
Exactly. And it prompts you to seek out healthcare relationships that feel like true partnerships, where you're an active participant in figuring out your path to feeling better. It's a shift towards engagement.
So the final thought to leave you with is this. What could this mean for you? How might looking at your health from this truly holistic angle, hunting for root causes, wanting that partnership, how might that open up new possibilities for your own well-being?
Yeah, maybe just consider, what does a whole person approach look like in your life right now?
Are there aspects, maybe stress, maybe diet, maybe something else that you haven't really connected to your overall health picture? That's something to think about?